I'm Dr. Joe Nemeth. I'm a periodontist in Southfield, Michigan. I talk a lot about cosmetic gum procedures like covering recession and gummy smile and how to correct all of that, and that's great and helps with appearance and helps with self-confidence. But I want to talk about something a little more serious today. Gum disease doesn't usually cause pain. Most of the time people don't know that they have gum disease. Most of my patients are referred by their dentist who sees the gum disease. Now they're finding that gum disease can actually take 7 years off of your lifespan. A well-known physician at Cleveland Clinic was talking about that recently. What happens is the bacteria that cause gum disease don't just cause gum disease and destroy the bone and cause tooth loss, but perhaps most and more seriously, these bacteria and their products get into your bloodstream and they cause a generalized inflammation or inflammatory response throughout your whole body, which increases your risk of all the cardiovascular diseases, heart attack, stroke. Also, they're now finding evidence in an article here from the University of Florida linking gum disease to Alzheimer's disease. Definitely has an effect on diabetes. I've had many patients who have diabetes whose sugar was very high or uncontrolled. One patient actually had lost a leg. We've treated their gum disease. Their blood sugar comes down, it becomes controllable, and some of them have actually been able to reduce the amount of medication. It has a dramatic impact on diabetes, and the worse the diabetes, the more powerful the impact. It's been linked to an increased risk in pancreatic cancer, especially among men. 59% increased risk of pancreatic cancer in men who have gum disease. It's also linked to lung cancer. There's a whole raft of systemic problems that gum disease is linked to, contributes to. It's kind of like smoking, and in some ways it's just as bad or worse than smoking. Gum disease is a silent killer that most people don't even realize that they have and don't know how dangerous it is. Get your gums checked. Here's an example of a patient came in, mouth didn't look too bad, but if you look on the x-rays, this bone level is down much further than it should be. Why is it down? Because there's been infection that you can't really tell by looking at the teeth and looking at the gums here. But there's been infection, and there are pockets of bacteria that are causing this bone destruction. And those same bacteria get into your bloodstream, and their products get into your bloodstream and can contribute very significantly to many, many other systemic problems. So get your gums checked. Make sure your gums are healthy. It can have a major impact on your general health and your whole body. Remember, a healthy mouth is a healthy body.
Restore your smile and your health with the help of Dr. Nemeth and his associates. Visit drnemeth.com to schedule your appointment today.